Good afternoon, ladies and gentlemen. I will be speaking about the government initiatives in health and implementation of healthcare policies in India, and especially with respect to role of CBHI, that is Central Bureau of Health Intelligence, which is organization under Ministry of Health, Government of India, which I represent. I will be just briefly telling you about healthcare system in India and the how flow of information comes from the lowest center upwards, and next about the role of CBHI and about its activities and its websites maintained by it. And we have a collaboration with WHO as a collaborating center on family of international classification, that is international classification of disease 10th version and international classification of functional disability in India, and also give you some examples of the use of information communication technologies in health sector in India. Just talking about the healthcare system in India, public health care setup in India encompasses the following structure of healthcare services, starting from the village level. There are sub-centers for a population of, say, about approximately 5,000 in plain areas and 3,000 in hilly and tribal areas, and these are manned by auxiliary nurse, midwife, ANM, and male workers. And at the panchayat level or sub-block level, there is a primary health center, commonly known as PHCs, which provide primary healthcare services and cover a population of approximately 30,000 population. And above that is block PHC, or which is lowest administrative structure of administration in the district. This is block PHC or community health, also community health center. At some places they cover a population of, say, 80,000 to 1,20,000. And above that is a district level where they have district hospital and some other specialty hospitals. And at a much higher level, at the state level, there are regional hospitals, there are medical colleges and tertiary care hospitals in states and also in union territories. And apart from this setup, which I have told you, there are various other ministries and departments of the government which run their own hospitals. That is, there are various central government hospitals, CGHS hospitals, railway hospital, defense and labor hospitals like ESI and all. So this is the best, just give you overview of the public healthcare system in India and how the information flows in this system, basically coming from the sub-center up to the district level. Is on the right side of the slide, you can see that records are maintained, whether at the registers, manually they are maintained. What I am trying to say in this slide, manually the records are being maintained, all health records are being maintained in some records, some register, and which are sent up to district level. And up to district level, at most of the state in India, there are no electronic transmission, except few states, maybe Gujarat or some other states like Andhra may have. But most rest of the states in India, up to district level, there is no electronic transmission of data. Only manual records are maintained. Above that, yes, there is electronic transmission, which also I will be dealing later. And regarding Central Bureau of Health Intelligence, it was established in 1961 as a National Nodal Institute for Health Intelligence in India, with broader objectives to maintain and disseminate a national health profile which uploads data from all the state health related data and data about health infrastructure and health manpower in India. And this is published and uploaded on the ministry's website every year. And next there is a health sector policy reform option database, HS Prod commonly called, which is nothing but a database of the innovations in health sector in India which have been taken place. So far we have been able to give, these are real life examples of these various states, which innovations, like you have heard Gujarat, Madam Anju Sharma. So I will request Madam Anju Sharma to, if you have not done, uploaded your the example like Mamta and transport services and other such examples, school health scheme, unique examples. Yes, we will like to upload. If you have not done so far, please check on our website, and I will request you send us hard copy and soft copy. I assure you, I will upload it on this website. This is nothing but website containing innovations in health sector in India. And just to give, because right now we are having 260 examples, just to give all stakeholders, whether NGOs, private hospitals, even private hospitals, Max, if you have some good examples, yes, most welcome. You can also upload. We are collecting good examples for rest of the people in India to know, and for rest of the world to know that, look, there are innovations, like Gujarat has done innovation, you have heard, but this is a small group, say 100 people. Outside this hall, nobody knows. But let rest of the whole world know what Gujarat is doing, what Max is doing. That's what my submission is. Next, we are also doing inventory and GIS mapping of all government health facilities in India, and also reviewing the progress of health sector Millennium Development Goals in India, and also an annual road safety profile in India. Then facilitate capacity building and human resource, very important. How to transmit and collect the data and transmit it. We are regularly conducting 6 months course, 1 year course, and also one weekly course for all medical and non-medical, like paramedical personnel at our various training institutes. Because to capacity building of the health person, they are our resources. So that also we are doing. And last but not the least, we are also doing need-based operational research for efficient health information system, as well as use of family of international classification in India. As I told you, CBHI has been designated in 2008 as WHO Collaborating Center on Family of International Classification in India. And under this, we are developing a medical record education and training program, seminars and conferences on medical record systems, use of international classification of diseases ICD-10, which is 10th version now currently in use in the world, for coding of mortality and morbidity data, and also ratification of use of family of international classification, FIC, and training and workshop for advocacy of family of international classification. That our collaboration with the WHO as a collaborating center. And as I told you, we are maintaining, with the assistance of NIC, 3 websites. One is CBHI DGHS.NIC, next is HSProd, where these innovation of health are being uploaded, and next is CBHI Government Health Facilities. So 3 different websites for online data transmission and public viewing. Regarding the first website, CBHI DGHS.NIC, it maintains national health profile, which is nothing but collection of monthly data online from all states and union territories for both morbidity and mortality about communicable diseases, non-communicable diseases, and collection of annual data online again from all states and union territories regarding government, both from government and private establishments, regarding their health infrastructure, health human resources, how much human resources, and again, may I request, although only one I know from Dr. Parvez from Max, if other private sector people are there in the hall, I will request them also to please send us this data about health infrastructure, health human resources they have got. And this is not only government, what I'm trying to say, private establishments also are to upload, because we are the, you can say, resource organization, which compiling organization for the whole country, not only government sector, but private sector, NGO sector also. Any health infrastructure you have got, any health human resource, whatever human resources, how many doctors you are employing, how many nurses, paramedical staff, that we are interested in. Because somebody in India has to be resource of all this data. So we are that somebody. We are also compiling mortality statistics in India, and also putting information under Right to Information Act, and also the national recommendation on improving, strengthening health information system, as well as ICD-10 in the country. The case study and its recommendation we are uploading, and also we are, as I told you, we are conducting in-service training programs throughout the year. And next website is HSProd, Health System Policy Reform Option Database. It contains entries related to health sector policy reform and being updated from time to time. At least once every year we make updation. So next updation is due. I will request all those present in this hall, please, if you have any good example of innovation in health in India, please send us. The email ID now, the website you can note down, HSProd India, is given on the top, hsprodindia.nic.in. That is the website. You see what I am talking, you just see on the website. Then I will, on my email or my office email, you can just send data. Through states and union territories in India, those states and union territories of India have undertaken reforms in health sector. A lot of this goes unnoticed, and hence my talk, and that's why I am requesting again and again all of you, so to send us, and to document whatever you are doing good thing. You know, I know, but it needs to be documented and publicized and uploaded. Thus, Ministry of Health, Government of India, under its sector investment program funded by European Commission, entrusted CBHI to develop and maintain this website, HSProd. It's a web-enabled database that documents and further creates a platform for sharing of information on good practices, innovations in health sector management. The HSProd website has at present more than 260 reform options from a varied range of fields and stakeholders in like states and union territory governments, development partners, NGOs, and has categorized them under 16 subject areas. And this is how the website looks like. The third and the last website which we are maintaining is CBHI GHF, that is Government Health Facilities website, contains inventory and GIS mapping of all government health facilities in India. It is a creation of electronic database of government health facilities, educational institutes, training centers, and other healthcare establishments in India. CBHI has prepared a database of government health facilities for their mapping using GIS for its wider dissemination through the website. This is how the website for government health facilities looks like. First view screen. This website depicts the exact location of each of the 116 different types of government health facilities in primary, secondary, and tertiary levels, concerning modern medicine, Ayush, Ayurvedic system of medicine, dental health, nursing, and paramedicals, and is located in all districts and all the states and UTs in India. Also covers Ministry of Defence, Railway, and Labour. Types of health facilities which we cover: sub-centers, PSCs, dispensaries, CHCs, secondary and tertiary level hospitals, medical colleges, dental colleges, nursing colleges, paramedical colleges of various fields, blood banks, public health labs, epidemiology labs, drug testing labs, medical stores, depots, PSC manufacturing drugs and vaccines, public health and research institutes, disability and rehabilitation organizations, etc. This is again how the screen looks like. Facilities shown all the list which I told you. This is just all India JS mapping showing PSCs state-wise and showing spread of PSCs in a district, say in a particular district. The number of how this PSCs are spread, you can immediately see once there is a mapping. This is village level map of Indore district in MP showing PHCs in the Indore district. So just seeing the map, you can know where are the PSCs located. Map of Indore district showing sub-centers, showing community health centers. Indore district map showing at least one CHC, PSC, and sub-center together located in a village. So regarding our training and capacity building, CBHI conducts trainings for development of trained manpower on WHO Family of International Classification ICD-10 and ICF, as well as medical record officer and medical record technician trainings through its various training centers located in Mohali, Safdarjung Hospital, Delhi, Jipmer, Pondicherry, Bangalore, Bhopal, Bhubaneswar, Jaipur, Lucknow, and Patna, various these field survey units and these training centers. So basically what we are conducting some 6 months training program or weekly training program depending on how long the state can spare their staff. Both medical people, non-medical, paramedical people are welcome to join. This is just the duration. So now, just to conclude my talk, I will give you examples of use of information communication technology in health sector in India. Excuse me. As I've been telling you so far, CBHI has been collecting online data entry and retrieval from district level upwards up to national level, and now efforts are on to get data below district level. And next example of use of ICT in India is telemedicine, which links district hospitals with tertiary level hospitals. This was planned in 11th plan of the country, and some states, examples which we always quote is Andhra Pradesh already implementing it. Some other states may be there. Next example is early detection and control of epidemics, IDSP, that is Integrated Disease Surveillance Program of Government of India, and also NRHM, National Rural Health Mission. They have brought together use of IT and satellite communication for information flow, video conferencing, education, and guidance. So this is a very good example of early detection, and idea is to detect any epidemic early, and if you detect, you will be able to control. So first to detect and control, and two-way communication. Next is web-based dissemination of best practices and experiences in health sector through our website HSProd, which I told you, and also inventory and GIS mapping of all government health facilities. These are very few examples of ICT, but these are, say, almost kind of innovations of use of ICT in India. Thank you. That's all I have to say. Thank you for a patient hearing.